While discussing the foot biomechanics, I will discuss first a subheading called movements. So, foot is a flexible joint which can help accommodate uneven grounds while it converts into a torque lever while propulsion and forward movement in phase of heel strike or push off. The ankle joint itself is a sagittal movement, which is plantar flexion and dorsiflexion. The subtalar joint is a conal movement, which is inversion and eversion. And the forefoot joints cause transverse movements, that is abduction and adduction. Number 2, a torque converter principle. A subtalar joint is a torque converter, transforming rotation forces into the forefoot pronation and supination via inversion and eversion. Number 3, it follows the Archimedes screw principle. Archimedes spiral screw principle. This means that calcaneus moves forward with inversion. Fourth important concept is flexible to rigid movement. What happens is that during ambulation, at phases, the foot has to be supple to allow uneven grounds, while at movements it needs to be rigid to have a good torque converter and movement. For that reason, the subtalar joint is important. When the foot is in pronation, it unlocks transverse tarsal joints and the two axes becomes parallel to accommodate even grounds. While in late stance, the foot becomes supinated, which locks the subtalar joints. The transverse method, the talonavicular and calcaneocuboid joint axes are diverted, so it acts as a rigid lever for push-off. The fifth important concept is a midfoot function as a rigid lever, which converts the hindfoot forces into forefoot propulsion. And this explains the long-term pain which happens following a Lisfranc injury. The sixth important thing in biomechanics is plantar fascia, which acts as a truss and works as a windlass mechanism. When metatarsophalangeal joints are extended, the distance is shortened between the plantar fascia. By plantar fascia, the distance between the calcaneus and metatarsals is reduced, and this helps to push off and lock the transverse tarsal joints, helping in turning the foot into a rigid joint. Number 7 is in surface area. The ankle has a small load-bearing surface area and high stresses of 500 newtons. Has a low contact area that is 350 meters square compared to 1100 meters square in the knee. So 1 mm Taylor shift will increase contact surface area by 42% as per Ramsey et al. Paper in 1976.